Hello, my name is Heather Pilch. I'm a master's student of athletic training at Indiana State University, and I kind of just wanted to go over a simulation that we had with some of the undergraduate athletic trainers where we went over patient to clinician experiences. And so this was to kind of help go over skills that we've been learning and get us ready for clinical practice this coming fall. So I was a patient with portraying left shoulder pain. Some of my diagnoses were I had left shoulder rotator cuff tendonitis. I also recently had labrum surgery on the left shoulder, as well as I was feeling numbness and tingling. So through this experience, I had to portray and kind of give off that patient history to the clinicians. And I thought going through it as undergraduate students were the clinicians, I thought they did great question asking to kind of further get to these kind of symptoms and problems. They went over different muscle manual tests as well as range of motion using a goniometer to kind of get measurements and comparing my non-injured side to the injured side. I thought they did really great at that, and it was kind of interesting to see how some of them have different skill sets as well as they conduct the test differently. I mean, overall, everyone got to the same end result, but it was just kind of interesting to see how some of them had me laying down to do the goniometer testing, or some of them had me standing up, sitting up. It was just kind of interesting to see how everyone kind of went over it differently. But we did resistance testing, the manual muscle test, as well as some neurological testing because I did have some numbness and tingling, so they wanted to make sure none of my nerves, or they kind of wanted to see if some of my nerves were pinched or just overall if anything was making it worse during these tests, as well as some of them did scapular displacement, or they just wanted to see my back or the shoulder without like clothing on it. That way they could see if there's any deformities, bruising, different things like that. And so I thought most of them did a great job with coming up with action plans for strengthening or just modalities they wanted to do to alleviate some of the pain or get rid of the numbness and tingling. Through my patient, I was a volleyball player, so the course of action as far as being able to play volleyball, they wanted me to reduce the amount of practice I was going to, as well as kind of come up with different modifications for my practices. So no like overhead movements, and then just being able to come back to the athletic training room to get ice or a simulation after practice in order to kind of combat the pain that I was probably going to have. And then at the simulation, they have the mannequins that you can speak through, and they move through controllers and stuff, and I thought that was really exciting, and I can't wait to be able to kind of go over those and use those when we further our skill set, as well as being able to use the IV trainers when we learn to use IVs and conduct the IVs, as well as I'm excited to kind of just be able to be on the other side of the patient clinician experience, and for me to actually be a clinician. I thought during this experience it was exciting because I do know some of the information or some of the tests. So when I was being the patient and the clinician was testing, asking these questions, I think it was a great experience for me to kind of see how everyone else does it and what I will be doing next fall. So I thought it was a great experience overall.